Nursing regulator open to reducing practice learning hours. News report by Ella Devereux. This Nursing Times news article, published on November 22nd, is read to you using an automated voice. The UK nursing regulator is genuinely open to the idea of changing the number of practice learning hours student nurses and midwives are required to undertake, a Nursing Times conference has heard. It comes as a new review into practice learning requirements across the UK, commissioned by the Nursing and Midwifery Council, NMC, is due to be published in the coming weeks. Sam Foster, Executive Nurse Director of Professional Practice at the NMC, shared some headline findings of this review at the Nursing Times Workforce Online Conference on November 21st. The review, being carried out by the Nuffield Trust, is set to inform the regulator whether any changes need to be made to its current clinical placement requirements, such as the hours students need to complete. Practice learning accounts for 50% of nursing and midwifery programs. Currently, nurses undertake 2,300 practice learning hours, of which 600 can be covered by simulated practice learning. In recent years, there have been some calls to look to reduce the minimum number of practice learning hours students must complete. The NHS Long-Term Workforce Plan, published under the previous Conservative government, said it wanted to explore how nurses can enter the register with fewer practice hours. It argued that cutting practice learning hours from 2,300 to 1,800 over the course of a nursing degree could reduce pressures on students while increasing placement capacity across NHS services. Ms. Foster told the conference that the Nuffield Trust report was due to conclude that there was limited published empirical evidence to determine the optimal number of practice learning hours a student nurse should complete. Similarly, it found limited evidence around the optimal number of births a student midwife should facilitate, currently 40. Ms. Foster said, "There's a variety of opinions on what optimal would be. However, the real consensus was, as I think we all know, that quality matters more than quantity. Outcome-based education is the focus of the NMC." Nursing Times editor Steve Ford pressed Ms. Foster on whether practice learning hours could be reduced. In response, Ms. Foster said, "I think one of the things that is really important to say is the NMC is genuinely open to this. So there's no fixed view in the back room." Ms. Foster noted that other professions were certainly not fixed to 2,300 hours. That might give you a guide that we're pretty open to reducing those practice hours, but pretty fixed on making sure that it's a quality experience to achieve the outcomes, she added. Meanwhile, Ms. Foster said the practice learning review identified confusion at times among providers about how to interpret the requirements for program delivery, including getting the right balance between depth versus breadth of knowledge for students. Another key area covered in the review was the opportunities and barriers in expanding placement opportunities for student nurses, Ms. Foster said. In addition, the research identified real variation in the level of undergraduate supervision being offered to students. Equality, diversity, and inclusion is set to be a major theme in the review, noted Ms. Foster. She added, "As you would imagine, there was some real themes that came through from this initial Nuffield work around inequity, racism, and discrimination in the practice learning setting, and the ability for colleagues to have their reasonable adjustments understood and continued. And of course, it identified the financial hardship and the barriers that undergraduates face undertaking programs of education." In the NMC's latest council papers published this week, the regulator confirmed that its review around practice learning was progressing well. It said it would be actively engaging with its steering and advisory groups during November and December 2024 to build consensus on recommendations for the executive. The findings and recommendations on next steps will be shared in January 2025, the papers confirmed. Thank you for listening, and head over to nursingtimes.net for more news and clinical articles.